am so honored today to be interviewing Dr. William Audeh and Kelly. She is a 6-year survivor. Here at Learn, Look, Locate, we feel it's really important to have these open conversations and honest dialogue about things like aromatase inhibitors. And so this whole interview, along with this project that I've been working on with the both of them, is dedicated to help people truly understand the ins, the outs, the ups, the downs, and the pros and cons. And so I'd like to introduce Dr. Audeh, if you wouldn't mind giving us a little background. And he is one of my amazing medical advisors, and I'm so honored to have you be part of this.
Oh, well, thank you so much for having me be part of this project. I'm a medical oncologist specialized in breast cancer. I'm the chief medical officer for Agendia, but prior to joining Agendia about 8 years ago, I was in practice for nearly 30 years in Los Angeles at the Cedars-Sinai Cancer Center, where I primarily took care of women with breast cancer. So I'm delighted to be able to participate with you and Kelly in this education program.
Thank you so much. And Kelly, real quick.
Yes, I am a 6.5-year survivor of HR positive, HER2 negative breast cancer. It was a grade 3 tumor, so it was quite aggressive, and I'm doing well today. Yeah, thanks for having me.
Awesome. I think it's really important that we have the open conversation. Many of us, including myself, were diagnosed with estrogen positive breast cancer. I had no idea what any of that meant. I was told after my diagnosis that because I was not in menopause, that I would be taking tamoxifen. I sat with my oncologist, learned all about the statistics, felt like a statistic, and did a lot of reading online and decided to be a little bit of a rebel. I think it's really important that people understand the pros and the cons. And Kelly is a graduate of aromatase inhibitors, and that's why we're having this conversation, because she wants to be a beacon of hope, a beacon of light, and really sharing her story on how she got to the finish line with the open questions that she might even also have for Dr. Audeh. But how do patients who are hit with this tough disease handle taking these medications that, from what I've read, see so many side effects? What can you first, I'd like to level set Dr. Audeh on the pros, the cons, and the education around aromatase inhibitors. How can we help people feel confident in their choice of, I know there's different options, but and how they go about this? Because we're overwhelmed, we're reading, we're scared, and we see a lot of the cons. I'd like to open the floor up to that.
Of course. Well, every drug treatment, of course, is going to have its side effects, as well as the benefits that have made it a specific treatment for breast cancer. I think that the problem with estrogen receptor positive breast cancer is that by its very nature, it is using the estrogen hormone to stimulate its growth. So the main way that we attack that type of cancer and prevent it from coming back in a woman who's been diagnosed with it and then had it removed surgically is to prevent estrogen from stimulating the growth of those cells. So where does estrogen come from? Well, in a premenopausal woman, of course, it primarily comes from the ovaries. But in postmenopausal women, it comes from all over the body in small amounts. There is an enzyme that's present in virtually every tissue of the body, the breast, the skin, the muscles, the fat, the bone, called aromatase. And that produces estrogen in small amounts all over the system. So when the ovaries stop making estrogen, the only way that we can interfere with estrogen stimulating breast cancer is to stop the production. And that is the basis of aromatase inhibitors. They help a great deal, and they've prevented recurrences of breast cancer in tens of thousands of women. But estrogen is in a woman's body for a reason. It has a lot of important and beneficial effects. And when you remove it with a drug like that, there are going to be side effects that I think everyone is familiar with. a lot of musculoskeletal side effects, arthritic symptoms, as well as other menopausal type symptoms that are made worse by taking an aromatase inhibitor, because the estrogen levels in menopause are already quite low, of course, and producing menopausal symptoms. But when we make them even lower with an aromatase inhibitor, it's expected that those symptoms will get worse. In my experience, just how severe the side effects are quite variable from woman to woman. It does seem to be very much affected by a woman's own health, as well as possibly even some genetic factors that may make some women more or less susceptible to side effects. So it's a very much personalized effect that I've seen in my practice.
That was such a great explanation. Wasn't it, Kelly? I mean,
Oh, absolutely.
thank you. I mean, I'm
Yes.
just understanding it. I mean, I try to convey this out on, social media, but anyone listening, thank you, Dr. Audeh. So with that being said, Kelly's was aggressive. You have that choice here, and you went ahead, you decided, you knew you needed to take it. How did you get through it? Because just even listening to, the explanation of the side effects, can you share with
Sure.
everyone? Yeah.
Yeah, well, my first oncologist, which I left about 6 months later, told me you'll just do a lumpectomy, tamoxifen, or radiation and tamoxifen. That's it, and was very cold about her approach. And I'm in the medical world, and I did my research, and I said, no, actually, that's not what I'm going to do. I did say I would do the tamoxifen, but I did a double mastectomy, and that eliminated me from having radiation. And it was not in the lymph nodes technically. So when I went on tamoxifen, I really had a lot of side effects, and I had a lot of joint pain, mood issues. I really was foggy. I just couldn't do it. So I went in and I said, I'm going to do an oophorectomy, which is removing my ovaries. And therefore I can go on an aromatase inhibitor. And she said, oh, I guess you can do that. She just didn't really educate me. So my advice for providers out there is please provide choices and educate your patients, because I know, because I'm in the medical world and I did my research, but a lot of patients out there are not. And what you don't know, you don't know. So if you can just say, hey, this is not always an easy journey, and there are options, we can always keep that conversation open. So I went on, an anastrozole, and had some joint pain, had some fog, did all right. And at one point I said, maybe I can do better. And I changed to letrozole, did not do well. I had more joint pain on that. And that's just me. It's individual. Some people do great on tamoxifen. Some people do great on letrozole. I went back on anastrozole and have osteopenia. So I went on Zometa to strengthen my bones. And my last Zometa infusion was in June. It was not easy, but I knew that this is just temporary. And I think if you just stay in your mind that this is temporary, you're not going to be on this the rest of your life, get through it, utilize your provider, because they're your coach. Your medical oncologist is your coach. And I utilized my pharmacist, and they were like my cheerleader. They said, you can get through this, Kelly. It's temporary. And every time I'd fill it, my pharmacist would say, one more month, you can do this. So I think that relationship with your medical oncologist and your pharmacist is really, really important and vital to my success anyway.
So can I share with you guys, I was at a very large cancer center. So getting the time with the oncologist was like so difficult. There were layers and layers and layers. And then I'd had to wait an hour to sit with the oncologist. So getting her, there's no phone calls. There was not that kind of relationship.
Yeah.
When you're at a large cancer center, there is the clout of, okay, I'm in good hands. But what I've learned is that personal connection is very lost. So I ask you, Dr. Audeh, what does a woman do who doesn't have the support and an oncologist like you
Mm.
to get them through this? Because, when you're left out in the wind with this diagnosis and reading those side effects, it's very difficult. That's why this project is so very important to me and to so many women who are starving for answers to these questions about all of this.
Yeah, yeah. Well, I'm, disappointed to hear your
Oh, yeah.
experience, although it certainly isn't an unusual experience. And the nature of medical care, unfortunately, has changed. That's a big topic. We could discuss it another time, but
Yes.
it has resulted in shorter time with oncologists in particular when there's a big need for information, discussion, and finding out what a person's own priorities are, because uh, it has to start with the risk of breast cancer that you are seeking to diminish with the treatment. Every woman's risk is different and unique to them. And so when I was in practice, I was very much focused on putting that in perspective. If a woman's risk of breast cancer recurring was very low, then while I might prescribe her the standard of care treatments, if she didn't tolerate it and wanted to stop, that was easier to accept because the risk that she was being left with was relatively low. On the other hand, a woman who had a high risk of a recurrence where the treatment was really going to make a very big difference in her future, then at the point that she might have wanted to stop, I may have spent more time trying to convince her of just how important this treatment is and the need to try to tolerate it to get to a safe place. That's the kind of discussion that I don't believe happens all the time, but
Mhm.
you have to put the risk of the disease in perspective with what the side effects are and what they're doing to your quality of life. Because it ultimately, you need the quality of life, not just the
Such a
quantity
good,
of life.
yes.
And so you have to reach a point where you've decided, I'm going to perhaps give up some quality of life for a short time in order to ensure that I'm going to be free of this cancer in the future. And that decision is really personal and unique to every individual.
So for me, and I don't know if this was you, Kelly, but the statistics were really presented in such a way that it scared me. So I even did a post on social media saying I left it in the pantry and I made my own conscious decision and I never did take it. And I'm not proud of that. But once I found out through some testing, and that's where working with you and understanding genomic testing and all the different tests that are available to understand risk of recurrence. Do I need to stay on for 5 more years? There's a lot of information that survivors are not aware of. It makes me sad every day because how do we educate them to really process this information so they know? So, Kelly, can you share with the audience? You're a graduate. What happened after you finished the aromatase inhibitors? And the other question I have is to you, Dr. Audeh, is the difference between all the different types. So I guess you first, Kelly, on let's celebrate this, but how do you
Well,
feel? They all want to know.
yeah, I first of all, I want to say thank you, Doc, that you explained what the aromatase inhibitors do better than anyone I've ever heard. And I understood it,
Yeah.
but I have to dumb it down when I try to explain it to people, and you were very clear. So thank you for that, because I think that's going to help a lot of people understand the
Yes.
difference, right? Um, but you are absolutely 100% on that. It exemplified all my side effects of menopause. I had more hot flashes. I mean, I was a mess, but I got through it. I took turmeric. I did, I had a cold washcloth by my bedside. So, I mean, you figure things out, right? Because it is temporary. Once I went off it, so it's been a year since I've been off the aromatase inhibitor. My hot flashes are almost gone. I'll get one maybe every few nights at 2 a.m. and other than that, I'm good. My brain fog, I'm a lot clearer. I can speak clear, I can find my words, and my joint pain is much better. And sexual side effects were rough for my husband and I, and that has cleared up. Everything's cleared up, and I feel almost normal. It's a new normal. It is. I still have anxiety of recurrence or other cancers, but I have a lot of cancer in my family, so I knew what I needed to do. I feel a lot better, 100% better. So yes, thanks for asking, CJ.
Yeah, it's important people hear this, right? I mean, it
Yeah,
really is. And
yeah,
Dr. Audi, I can't remember the question I had. I wrapped
Well,
her too.
I remember, but I'm very happy to hear that many of those side effects diminish, which is really what typically happens. The side effects of aromatase inhibitors, can start as soon as 6 weeks after starting. They usually peak around 6 months, but for most women that I cared for, if they stuck with it, they usually started to diminish after some time. Not
Oh,
for everyone, but for some it did. So my guidance was always, all right, well, the first 6 months are going to be the toughest because that's when you're going to feel the real change. And then let's just see how long we can ride it out and see if it gets better. And in the meantime, we'll do everything we can to mitigate the side effects. And as you mentioned, you found all kinds of solutions for the side effects. I think the joint pains are, I think, the most severe things that cause people to want to stop these drugs. And while I can't say that any one of these remedies always works, I find that for many women it did help. Certainly, we recommend exercise just to
yes.
keep the joints moving, just as with any type of arthritis. Acupuncture has been proven actually to help
wow.
specifically this kind of side effect. For all of the different uses of acupuncture, this is one that actually has medical evidence behind it that it can work.
Mm.
Non-steroidal anti-inflammatories, ibuprofen, those sorts of drugs can help somewhat, just like with any arthritis. And then there's even a drug called Cymbalta or duloxetine. It's actually an antidepressant drug, but it actually does seem to help some of the side effects of aromatase inhibitors. And again, that's been proven in
Wow.
clinical trials. You don't want to turn to a prescription drug to solve the side effects of another prescription drug unless you absolutely have to. But
Mhm.
that's been tested. Omega-3 fatty acids, anti-inflammatory herbs, things like turmeric, all of these things have been looked at and may help to some extent. So for a woman who's motivated to try to stay on an aromatase inhibitor and deal with these, there's a list of things that I always tried, and we worked through all of them. There's three main aromatase inhibitors, as you probably know, letrozole and anastrozole are chemically pretty similar. Their side effects are pretty much the same. And then there's a third drug called exemestane, which is another aromatase inhibitor that is chemically built a little differently. So normally, if someone was having trouble with letrozole or anastrozole, I would try switching them to exemestane because it was simply handled by the body differently. And in some cases, it seemed to help with the side effects, and in others, it didn't. But ultimately, all three of them pretty much do the same thing, cause the same sorts of side effects, and provide the same level of protection.
Wow, this is so helpful. I know we're short on time here, Dr. Audi. Any closing thoughts? Because this, I hope, will be seen globally to help women all over the world. This disease is on the rise. It's incredibly unfortunate what I see every single day. And I see the comments, I see the questions. There's not even enough time to cover the amount of questions that I have. But Both of you, encouraging thoughts? Dr. Audeh first.
Yes, of course. I think aromatase inhibitors wouldn't be the standard of care for anti-estrogen therapy for postmenopausal women if they hadn't been proven to reduce the risk of recurrence in a very major way. They are really incredibly powerful and helpful drugs. But of course, as with any such treatment, they carry significant side effects. And I would say that it's something that can get better over time for many women. And you really have to draw on all the resources you've got, not just the few minutes you may have with your doctor, but resources such as this type of website, information that's out in the media. Wherever you can get information, I think the better informed you are, the better you'll be able to handle this kind of challenge.
And I just want to say, Dr. Audeh is a medical advisor for Learn, Look, Locate, and having you be part of this mission was my biggest wish. We need more time with the medical community, so I can't thank you enough. And Kelly?
Mm-hmm.
Closing
Yes,
thoughts?
I would just say, remember to have that relationship. I do have an amazing relationship with my medical oncologist and my physician's assistant in the cancer center, and to have those open conversations. Don't be afraid to ask them questions, and include your pharmacist, because they're the experts on multiple medications, right? And I think that they can be your cheerleader. So between the two of them, make sure that you have that relationship. A second opinion is a second opinion for you to make sure that you feel comfortable with that medical oncologist. It's really, really, really important. And a great medical oncologist is going to welcome second opinions. So when you have that relationship, those open conversations, you can be successful. You can get through it. For those women out there that are taking these drugs, you can get through it. Just keep at it. And I would say make a goal for yourself. Okay, I'm going to get to that 6-month mark and see where I'm at, and celebrate those milestones. I think that's really important for patients.
Yeah.
It's not going to be easy. You're not going to have great days all the time. You're not going to have bad days all the time, but you can get through it.
That's awesome. Thank you so much, both of you. I'm so honored for your time today. So I hope this helps a lot of people. And thank you again.